Hello, everyone, and welcome to today's presentation, Opening the Door to Lifesaving, How Portals Can Save Shelter Cats. Today's webinar is being presented by Virox Animal Health, the makers of Rescue and Prevail disinfectants formulated with accelerated hydrogen peroxide. You'll have the opportunity to submit your questions at any time in the chat located on the right-hand side of your screen. Send in your questions at any time. Our team is standing by. So without any further ado, I would now like to introduce Dr. Sara Pizano, founder of Team Shelter USA, advisor to the Million Cat Challenge, the assessment mentorship lead for Maddie's Shelter Medicine Program, and the author of the Best Practice Playbook for Animal Shelters. Over to you.
Thank you so much, Sarah. I'm so excited to be speaking with you today. We have over 2,300 people registered from all over the world. So welcome in whatever time zone you're in. I'm so excited to be here talking about my second favorite thing. My first favorite thing, which will be incorporated too, is how to keep animals out of the shelter. But if they come into the shelter, especially for those cats, those portals are so important. So I am the founder of Team Shelter. I do community and shelter assessments around the United States. I am also part of the Open Door Veterinary Care Training Program, which is an access to care program that will be starting soon. And that is Potato, who was my foster dog, but who now is my own dog. I'm not a foster failure. I'm in a successful adoption. And that's just to remind you that Team Shelter and our assessments with the University of Florida and Million Cat have to do with dogs and cats. I want to thank Virox for hosting this. It's such an amazing platform with such a beautiful reach, and I really appreciate the invitation. So there's 3 thank yous. The second thank you is to Virox for being one of the funders of Portal Mania. And recently, when COVID started, our team at the Million Cat Challenge said, wow, this is the great time to install portals in shelters because the inventory, the number of cats in shelters is so low. So we thought, oh, if we just raise a couple $1,000s, that would be amazing. Well, guess what? We raised enough money to purchase 3,684 portals for 122 shelters. And now with the help of Greater Good, we are still continuing to fundraise. So we're so excited that Virox and Team Shelter was also a sponsor. Everything that I'm talking about can be found in our standard protocols. Many of you already know the Association of Shelter Veterinarians, and years ago, that organization published the guidelines for standards of care in animal shelters. Lara's going to put these links in the chat, the websites, as I'm speaking. So those guidelines can be found at sheltervet.org, and then, of course, the millioncatchallenge.org. The playbook is really, again, dogs and cats, best practices from soup to nuts, what happens in the community programs, public policy, how we treat the public, what our intake policies are, community programs, population management, how we're caring for animals in the shelter, and how we're getting them out alive. The playbook link will be in the chat as well. It's available on Amazon. If you haven't heard yet about Fear Free and you work for a shelter or volunteer for a shelter, I'm so happy to tell you that Fear Free certification for shelters is now free. And this is an online self-paced training, but this is the name of the game. We have an obligation when we take animals into a shelter to make sure it's a fear-free environment, free of stress. That's my dog and cat from years ago. And I think of that picture and think, that's what I want. That's what we all want for animals, whether they're in the shelter or not. We want to prevent them from going in the shelter, but wouldn't it be great if that's how they felt when they are in the shelter? So please, if you're not Fear-Free certified, go through the certification now. And there's tons of resources, handouts, all kinds of different training. And there's now a magazine available as well. We have had great progress in the United States in the last several decades. Back in the 70s and 80s, more than 20 million animals were going into shelters. Best Friends reports that in 2019, that number is down to 5.4 million, and a little over 500,000 of those animals ended up being euthanized. But the message I want you to understand is cats are twice as likely to be euthanized in United States shelters. So 60% of those euthanasias were cats and 30% were dogs. So we are failing in a lot of ways, helping cats getting out of shelters alive, and it's something we need to pay attention to. We're doing so much better for dogs. So what are we talking about with portals? What are they? Why should we have portals in our cages, and how could we possibly make that happen for our shelters? So a portal is simply a passway between two cages, and the commercial product looks like this. It's actually 3 pieces. The door is 1 piece, and then that circle has 2 pieces. This is the commercial product that was designed by Dr. Danae Wagner at the University of California at Davis, but is now manufactured by Shoreline. So you can certainly purchase this portal and have it shipped to you, but there are some shelters that do it themselves. So they would use the PVC piping to sort of manipulate and protect the cats from the hole in the metal. And then some shelters say, oh, that's just too time consuming. It's just faster and easier and cheaper for us to just purchase them. But just know that there are DIY examples of these portals as well. But it is simply a way to connect 2 cages so that the cat has the litter box and the food water bed separated on 2 sides. So I want to ask you, as a person, what keeps you calm and stress-free? When we think about this for all people, it's the confidence in knowing that I know what's going to happen. There's a familiarity with my routine. I know what to expect. I know that I have options, or if I have more options, I can then decrease stress. I remember listening to Chris Rock, the comedian, once, and he said the only difference between being poor and rich is options. Because when you're rich, you can eat at McDonald's or you can eat at the steakhouse. But if you're poor, McDonald's might be your only option. It limits your options. And that's something that can add stress to us as people. Physical discomfort, right? That causes us stress. The ability to rest and get a good sleep and have downtime and make sure that we're relaxing our brains. This is, as people, this is what we need. Now I ask you to think about a dog or a cat. What's different about that? Absolutely nothing. Dogs and cats need the same things. They need to know that they can depend on the people that are around them and can make sure they understand what's happening and that they don't need to be afraid. But when we think about the traditional animal welfare system, it's anything but that, right? So we're taking animals into a very unfamiliar place. Most animals have never been to. It smells bad. There's animals barking. There's unfamiliar animals and people, and those people are constantly changing. There's visitors coming in. I moved multiple times. Once I get settled into a cage or run, just when I think everything is okay, I get moved to another area. There's a disruption in my daily life. So all of those things add up to stress for dogs and cats. And I want you to think about dogs and cats no different than you and your environment. And it really will help us provide a better environment for animals who are confined. Why should we portalize? Because every animal that is in confinement should have an option, a minimum of 2 compartments, so that where they rest and eat is separate from where they eliminate. So in the case of cats, separate from their litter boxes. For many years, I mean, gosh, I don't know what happened in the 60s in the United States, but there certainly were a lot of shelters built. None of those people who built shelters knew cats because they just put them into a cage that they could fit into, not thinking about what they needed, just how many cats can we fit in this room. We now know, and this is beyond a shadow of a doubt, that less than 11 square feet of space for a cat is stressful for them. They are finicky, they are clean, they do not like having their litter box right next to their food. Stress then brings out the viruses that are in their respiratory tracts, and they develop an upper respiratory infection, the dreaded URI in cats, which is viral, which makes it so much harder to treat. And I don't have to tell you all what happens then. Now they are more at risk of not being available to the public, not getting adopted because the public doesn't want a sick cat, maybe can't go to rescue because rescues don't have the ability to isolate. Maybe the shelter doesn't have time or money to treat them. Therefore, they get euthanized. So a big chunk of those euthanasias that I just told you about have to do with this. And in 2020, we know differently, so we need to do differently. So the double compartment housing, it's same for dogs. Dogs need double compartment housing as well. And this is also tied into the sanitation and how we handle cats in shelters. But the shelters I help all because we tend to help shelters that are euthanizing a lot of cats. They typically are not portalized. So I have many examples of overcrowding. So in this picture here on the right, you can see 2 kittens, and the cage just goes from the side where the kitten is on the right just to be on this food. And there are 2 in there. So that is not enough space for those kittens. In the bank on the left, you see litters of kittens in the same size cage. So again, well below that 11 square feet or more per cat. Here's a cage that literally just goes, is probably 2 or 3 times the width of the cat. Worse is these cage bottoms had slats in them, and that's actually something that we recommend against. So besides the small width of this cage, the slatted floors are also not recommended. And when you look at this cat, it's very easy to see that you're not meeting the 5 freedoms. The litter box is on the right, and it is right up against the cage wall. And this is called a feral den, sometimes a hide box. This is for cats to hide. So the plexiglass or the opening should actually be against the wall, number 1, and the hole on the side should be kept open. Worse, this cat has to walk through its litter box to get through its bed. And then, of course, the food and water are right here. So we know that part of the 5 freedoms is for an animal to be able to lay in a normal posture. And this cat cannot rest, sit, lay down, or stand without touching something, which is again stressful, which is again leads to upper respiratory infections. So you see another example of the cage on the left. For those youngins out there, I'm a child of the 60s, so way back then, in the olden days, in the 80s, we had these things called telephone booths. And you went into the telephone booth and put change in the telephone to make a phone call. So this is a telephone booth. So this is no different than I told you, hey, you're going to stay in this telephone booth for a month, and your toilet is going to be in there, and that's where you're going to have all your food, all your meals, breakfast, lunch, and dinner, and that's where you're going to sleep. This is no different than this picture on the left when you think about it from how a person needs to operate in the world and rest and eat. Again, cats are so finicky, they don't want their litter anywhere near their food, just like we don't want to eat in our bathroom. The first question I'm sure a lot of you are asking is, how could we possibly portalize and make these double compartments? You don't understand, Dr. Pizano. We have cats coming out of our ears. There's no way we could do this. And so I want to take a step back and tell you, yes, you can, but we have to talk about your policies and community programs first, because these things are all tied together. And when you are trying to influencing people in perhaps engaging and implementing these particular programs, please remember this if you remember nothing else. If you take a pet into a shelter, it is your responsibility to make sure they have a fear-free environment in the shortest length of stay and are out the door. That's after we have exhausted all possibilities. We have this shelter intake bias, and so we think, oh, this is the only way we can help animals, and it's just not true. You may have barriers, maybe, to these programs that I'm going to talk about. Some of them are perceived, some of them have different layers and levels of barriers. Maybe it's elected officials, maybe it's community advocates. We're here to help. So please visit millioncatchallenge.org. You can certainly reach out to me at teamshelterusa.com, which is my website, and just click on contact us. But we are here to help. We promise you there is a better way. And it's called managed admission. We are all part of, at the University of Florida and Million Cat, we're part of a new movement called the Human Animal Support Services. The website will be in the chat for you. But this is, again, the same principles that you will read in the playbook. We have to create a community-centric sheltering system as opposed to the shelter-centric system that we now operate in, because we have proven that it is not the appropriate approach to helping more people and animals. That the way we're going to help is by productively decreasing shelter intake and helping people in ways other than intake. So a couple of those things might be helping a finder turn into a foster. What about teaching your community? Those kittens, leave them be. Their mom is going to come back. If they look healthy, they're clean and plump, leave them be. Their mom will come back. We'll spay the mom as soon as we can, but we're going to work with you on that. Safety net. What do you need to keep or place your cat or dog? And we're talking about cats today, but certainly all of these things apply for dogs too. The better dogs do, the better cats do, and vice versa. Are we just allowing community cats to flood in our shelter? If so, we need to be collaborating with every animal welfare organization and doing targeted TNR in those high intake places, along with taking those community cats that came into our shelter that weren't lost to begin with and put them back where they were already cared for. That's called shelter neuter return, sometimes called return to field, which is not what you're doing. You're not returning them to a field. You're returning them where they are already cared for, but we're going to say a few more words about that. And when we talk about safety net or surrender mitigation, people often say that's never going to work here, because remember, our brains trigger to the negative. So we automatically think, oh boy, that one person out of 100 said they wouldn't do it, so that's the one I'm going to use as an example. That's what we do as people. We trigger to the negative, but we promise you, if you engage people and ask them what they need and try to provide resources, you can do what they did in Brevard County Sheriff's Office in Florida. The first year and every year since, 4 years and counting, 80% of the potential owner surrenders are helped in ways other than taking the animals into the shelter. They decreased owner surrenders by 80%. It's amazing. And they did it in a budget neutral way. So there were no staff added. There were no other accommodations added. Another vehicle you have at your fingertips is home2home.org or Adopt a Pet Rehome. Those are just virtual ways that you can educate people who need to surrender their pets and link them with an adopter so the pets never come into the shelter. So how beautiful is that? We are not the only game in town. And in fact, most people adopt their pets from other places. Only 1 in 4 pets are adopted in shelters. So that's a great way to do it. Community cats, we have to remember when we talk about taking community cats into our shelter is that about half of cat owners allow their cats access to the outside. I'm not one of them, but I don't judge people for it. This is the way Americans live with cats. On the flip side, don't ask me why. In animal welfare, we've told people if you see a cat outside, they must be lost, take them to the shelter. Why did we do that? When we know half of the Americans let their cats in and out, so they're not actually lost. And worse, if they do enter a shelter, less than 2% nationally are returned to their owners. So it makes absolutely no sense, friendly or feral, to take these cats into the shelter. Lara's gonna post this webinar that we did with the Million Cat Challenge. If you have any questions about community cat programs and the super highway to get these cats out and prevent them from coming in the shelter, and guess what? Not only delay your kitten season, but sometimes shelters that do it right don't even have a kitten season anymore. And I know a lot of you are sitting there saying, she has no idea how many cats we have in our community. Yes, I do, because I've seen so many communities doing it right, and I'm going to show you some remarkable statistics. But please watch this webinar that's going to be in the chat if you're not doing these programs, because there's so much research and data packed in that webinar to help you influence others to support you. But this is how you will be able to install portals in your shelter and decrease the number of cages by half, right? So this whole bar is the combination. Green is live outcome and blue is euthanasia. This happens to be Nashville, Tennessee. Look at what happened, the dramatic decrease in intake and euthanasia in Nashville. A big part of this was because of community cat programs. Their live income, the green, goes up. Live outcome is the green that increases. So beautiful, beautiful trends that can happen in your sheltering community. Look what happened in Waco, Texas. Same thing, dramatic. We've never seen these dramatic decreases in shelters until COVID, of course, but this was long before COVID. We've been proving that these programs work. How about Greenville, South Carolina? Remember, the green is live outcome, the blue is euthanasia. They started this program in 2016, and first year, 2,000 less cats went into the shelter and 2,000 less euthanasias. And again, second year keeps on going. It's the gift that keeps on giving. This year, 2015, when we were there were no portals, because guess what? All the cats were crammed in cages like postage stamps. They didn't have the space, right? Now, what happened? There's the portal. And guess what? In 2019, when I went back for a visit, this was the only kitten, only feline in adoptions. So what an amazing transition, and I want to encourage you all, you can do this. Sometimes I've heard this question, won't they ruin our expensive stainless steel cages? Absolutely not. Your cages, if they are less than 11 square feet, do not provide appropriate housing to house cats in a humane, fear-free way. So putting a portal will actually improve your housing. And so you should not be afraid to do this. It is your obligation. And number two, if you are purchasing new cages, Shoreline now designs the stainless with the portals already in them. So that's amazing. So Dr. Janae Wagner has so many great videos and information on the UC Davis website, which will be in the chat. And again, Dr. Wagner, shout out to her. She's created these portals and now they've exploded. We're so excited to see so many shelters installing portals. This here is the template, which you also can purchase. It's just for you to use to make the circle, to mark off exactly where you're going to put the portal. You want to measure once, cut twice, and the tool is a nibbler. Any handy person like Dr. Wagner can pop out this hole. The portal comes in 3 pieces, and then it's combined. The third piece is on the other side of the wall of this stainless steel cage. Some of you have cages that are 3 across, so you have 2 options. You could join 3 cages, or you could take these cages apart and make them 2 and 2. Maybe or you could do 2 and 2 and then an up and down portal. So this is also another option for you. I always want animals to feel when they enter a shelter like they're entering a hotel. And so again, what is least stressful? And I want to ask you, if you stayed in a hotel and you checked into the Hilton for 5 nights, do you want to move every single night? Of course not. That's stressful. It takes up more time. I want to check in and stay in my hotel room. Same with cats and dogs. So we want them to be comfortable in this space. We want to spot clean, which means everything stays unless it's soiled. We change the litter, but they are familiar with those smells. They understand that's my towel, that's my fleece. And the only time the portal door is closed is during that spot cleaning. Otherwise, this stays open. So again, just like a hotel, you want to make sure they have a soft place to rest. I read an interesting study that I'll have to get my hands on, but it showed that cats and dogs prefer fleece versus towels. So it's an important thing, right, in shelters that we provide the most comfort. And if you have fleece that are not giant blankets, but smaller pieces, then you can wash them and dry them just as easily as you can towels, and they'll probably dry quicker. But animals need to have something to do. They need to have toys. Cats love to perch. They need a hiding place like the box, or perhaps having a curtain over one side. Cats are like horses. They want to eat ad lib. They want to graze all day long. So you should always have dry food for them and give them the option of canned food twice a day. Maybe they don't want it and they just want the dry, but they should at least have that option. So again, when I'm at the Hilton, nobody comes in when I go out for the day in a hazmat suit and does a full disinfection. They come in, they tidy up, they make the bed. If I put the towels on the floor, they change the towels, but I always keep them hung so we are environmentally friendly, right? And then after I check out, that's when they get they do the full disinfection. So think about spot cleaning in cats the same way. The full disinfection is after the cats leave. So when you spot clean, listen, if it's a wholly hot mess, then you can do a little bit of a clean, but you don't have to do the disinfection until they leave. I love rescue. I actually asked Virox to sponsor the playbook because I really do believe in rescue, and it's the only disinfectant that neutralizes odors so that we can provide a fear-free environment. We have a better chance of doing that. It's great against all shelter pathogens, so highly recommended. Of course, I had to stick in my foster kittens here that are much older now in their new home, but so cute. And just in summary, I want to go over some of the highlights with installing the portals. We want to make sure we're giving cats and kittens the appropriate space. Also want to mention that Shoreline makes puppy portals for the same reason. So if you have stainless and you're keeping puppies in it, the puppy portals are a little bit bigger, but you can also get those in Shoreline. It is imperative that all animals have double compartment. so that their bed, water, and food is separated from their elimination area. This allows your staff and volunteers to spot clean safely. It is unsafe for and really stressful for cats to be removed from a cage and have everything disinfected. It's also more risky for your staff and volunteers, especially if you have fractious or really scared or feral cats. They do not want to be moved. I don't have to tell you that. This makes cats more adoptable. So we are providing them, we're giving them the tools to stay healthy, to stay happy. Your medical costs will go lower. Shelters report their length of stay for cats is lower because they're more adoptable. So you have a greater life-saving potential. Just like they say, happy wife, happy life. Happier cats, happier people. And when cats, we do better for cats, we do better for dogs too. And this also links in to our peace of mind and our compassion fatigue. So I want to thank all of you for joining us today. I have two guests that I want you to hear from, so you don't just take it from me and my examples. And I would like Karen Slumba to join me. She's the executive director at the Animal Welfare League in Charlotte County, Florida. Welcome, Karen. Thank you so much for joining us today.
Hi, this is such an important topic. Today is actually my day off, but I needed to be here to share what an impact portals have had on my shelter. So I began as the ED at the Animal Welfare League 2 years ago. When I walked into this county facility, I was really shocked and appalled. So our organization was basically considered a slaughterhouse. A lot of animals were dying in my shelter, and it was not for lack of my staff really caring about these animals. It was just that, they hadn't evolved with the rest of the industry.
Yeah, they didn't have the tools, right?
Exactly. All they needed were the tools. Our live release rate was 72%, which is not worse, but it's also not anywhere near where we needed to be. So there were several things, all of which Dr. Pizano has already spoken about, that we put into place immediately. The TNR program, the shelter neuter return program, the safety net, helping people keep their animals in their homes so we didn't have a giant influx of animals. But when I did get there, we had 300 cages in our intake building. They were all about the size of a microwave. I mean, literally the cat's food was practically in their litter, and every single cage was full. And when you have that many cats and you have, you're so overcrowded, their length of stay is really long a lot of times. You can't adopt that many out that quickly. So the cats were getting very, very sick. So my euthanasia numbers when I first got there cats were our highest number of euthanasias. The vast majority were cats. We also had a cat hospital that had about 60 cages with an overflow room that had another 30 cages. Every single one of those cages were full with cats with URI. So we recognized very quickly, URI at my shelter before I was there, we had a veterinarian who was just euthanizing any cat with URI when we reached our capacity of our 90 cages in our hospital, and overflow area. So, one day I went into our intake area, and I looked and I noticed a cat was drooling and had upper respiratory symptoms. And I said to my vet, I said, well, it looks like maybe this cat has calicivirus. So what is your treatment protocol? She says, euthanasia. So I'm like, oh no, that's treatable. We're not going to be euthanizing these cats. Long story short, what happened is A, I got rid of my vet. B, we started putting portals in our shelter. And at the same time, we were focused on bringing fewer cats in than we had previously. So we went from open admission to managed admission. And don't let that term scare you, because you can still say you're not turning animals away. You're still essentially can be
helping people just in a different way.
Exactly. You can still be open admission. You're just not, it's not like, hey, bring us your animals. It's more like, we'll take whoever truly needs us. And that is still open admission. So we started taking fewer animals. We portalized virtually every single cage in our facility, which is a lot. So now that we have a much lower population, our cats have not just 2 cages, they have 3 portalized cages. And so, you know, it's like basically a condo for them.
Right.
And
talk about what happened with URIs. Like, talk about URIs.
I'm getting no. So what happened with URIs? It stopped. So let me tell you something. The hospital and the overflow room right now, we are using the overflow room as storage because we never have cats in there.
Wow.
And the hospital recently, I think we've been using it actually for ringworm isolation because we don't have URI. If I have 1 case of URI at my shelter right now, usually those cats now go into my office because like there's only 1 or 2. So it's really next to nothing. Portals were a game changer for the cats in our shelter.
Right? Oh my God.
And now it has made it so that we not only almost never euthanize cats unless they're dying. So my live release rate now is 97%. I'm really proud of that.
Oh, girl.
Yeah, and but we almost never euthanize cats unless they come to us and they are dying. And not only that, but this whole shift has allowed us to reach out to the shelters in the big cities that have greater challenges than I do. So if they're euthanizing, we pull cats to help them. I now take probably a quarter of the feline leukemia and FIV cats in our state, because we have room now to do this. We have room for diabetics. We have room for hyperthyroidism. So I cannot emphasize enough that this is worth the money and it's worth figuring out.
Absolutely. And Karen, can you speak to when you decided to install the portals? Were there staff or volunteers that said, we can't do this, it's not, or, you know, talk about that and how you overcame that. And are they now the preachers as well, like you?
I just fired everybody. No, I'm kidding. No, I did. I got some pushback. Pushback from my staff, just because it's kind of like change is hard. They weren't used to it. The funny thing is that my staff was saying, but it's going to make cleaning harder. And I'm like, what are you talking about? If you have 1 cat for 3 cages, that's only really basically 1 cage you're cleaning. But that was a big fear for them.
I wonder if think that, because if you're a spot cleaning, you don't have to take the cat and put it in a carrier. Like,
I know.
That's interesting that I wonder why they would think that.
Because you know what? Because they were walking into the unknown. So
Yeah.
they didn't know what to expect. The funny thing is now when we're getting full on our portalized cages, like, you know, because now I have like only 100 cages. So if we're edging up to 75 cats, they start panicking, going, well, we can't close portals. Yeah. And I love it. It's a total shift. They do not want to ever be in a position to close the portals because they know what a difference it's made for the cat.
Love it. That's amazing. Awesome. Well, great. Thank you so much, Karen. I appreciate it. I'm going to ask Olivia to come on. This is Olivia Todd. Karen and Olivia will join us. Sorry, Olivia, I meant to have you on first. Sorry about that, but we're still good.
Okay.
But this is Olivia Todd from Halifax Humane Society in Daytona Beach, Florida. And Olivia, why don't you tell us a little bit about your portal story and what you saw before and after as well?
Yeah. So I've been at Halifax since about Thanksgiving last year, so not quite a year yet. New to animal welfare professionally. I'd always fostered and everything. So we had portals in our adoption area, but we were not using them. and none of our other areas had portals. And then when you came and did the consultation in January, we worked really hard to do adoption specials and get cats out so we could actually open up the portals in our adoption area. And we installed portals in all of our other areas as well. And story is really, really similar. We had an intake room that had, 40 kennels with no portals, and it was always full, and all of the cats were sick always. We had an isolation with 40 plus kennels, always full. Cats were always sick. Every area of the shelter, tiny cages full of cats. All the cats were sneezing and sniffling and all of that. And it was really scary at first. We were like, we have too many cats. There's no way we're going to be able to use portals. There's no way. And, we worked really hard to try to get cats out for adoption and really be able to utilize the portals. And since then, we have no cats with upper respiratory. If we have cats with upper respiratory, it's because they already had it when they came in. They don't stay here long enough to get sick. We're using our isolation for ringworm and scabies now instead of for upper respiratory. And we actually remodeled our intake room as well to only have 14 kennels. And it's only for animal control to be able to drop the cats until they can get their vaccines, and then they go to their final location. Cats do not stay in there. They used to stay in there for over a month at times. And now the cats do not stay in there. They just get their exam, their vaccines, and they go to our cat holding area or straight to the adoption floor.
Right. Amazing. And Olivia, when you transitioned, you installed the additional portals, but then you were opening the portals in adoptions. Can you revisit any pushback you had from staff or volunteers?
We did have, it was mostly from our intake staff because they were the ones processing every cat as it came in, and they were pretty much saying, there's no way, we have too many cats here. There's too many cats in Daytona Beach. It's not possible. This isn't going to work. Yeah. And we did it. And now they don't have to clean 40 kennels every morning as part of their routine. And the cats are not sick. And they really have seen now, and I think their stress level has gone down. I remind them occasionally what it was like before, on days where they're really stressed out. And, they're like, you know what, you're right. We don't have a bunch of cats in here. It's great. So it was mostly the intake staff. We also did get a little bit of pushback from some of our adoption side animal care workers when we tried to get the cats out and have certain adoption specials. They were concerned about free adoptions and stuff like that. But when they saw that the cats got out and then the cats were so much happier because they did have the portals, they realized that, it was really for the best.
Ellie, we're so proud of you and your team. And I know you also implemented safety net. So there were a lot of moving parts to your success around portals. But I also want you to share with people how you touched on your staff. The compassion fatigue was, listen, it's still stressful, but it wasn't can you talk about that? It wasn't like it was before, just your intake alone, right? With safety. Yeah. So why don't you talk about the change in compassion fatigue with your staff?
Yeah, so there was a lot of compassion fatigue just from seeing all of the sick animals. And then our intake staff is also our primary euthanasia team as well. So they were the ones who would have to ultimately euthanize the animals when they got too sick for us to treat them. And now that they're not having to euthanize literally 50 plus cats a week, their quality of life and their experience at work is also a lot better.
It really just warms my heart, and I'm so grateful to you both for coming on today and talking. And I want to encourage everyone who's listening, we understand it's very difficult to see the forest through the trees. When you're buried in work every day, you can't imagine you're buried in animals, right, coming in and flooding in the shelter. You can't imagine it a different way, but we promise you the stories that Karen and Olivia just told are repeated everywhere, everywhere. Every shelter experiences the magic of managed admissions, of safety net, of then being able to put in those portals. So we really want to encourage everyone. Anything else before we go to questions, Olivia, that you want to add?
That we also had to work really hard with animal control and, the community cats. And we've recently actually developed some MOUs with some of the jurisdictions to increase our TNR services as well, because that was another major area where we had excess of cats, is the ones that are not socialized, are community cats. And animal control was just bringing to them us in waves and waves. And so that was also a big shift as well. It's still a work in progress, but I think it's definitely helped. And then the managed intake for sure is extremely important.
Yeah, for sure.
Just didn't even know the options, the alternatives, and now they do. And it's definitely changing our community as well.
Right. And with that community cat piece and the municipalities, that webinar that's in the chat from the Million Cat Challenge will be so helpful for everybody, because it's factual that just removing that cat from the neighborhood and putting him through the shelter system doesn't actually do anything. It makes it worse because you have a bigger carrying capacity, right, in the community. So sterilizing those cats is the most important thing that will provide sustainable resolution for your communities. Karen, any final comments before we go to questions? And I want to not forget to say thank you for joining us on your day off. We really appreciate it.
Like I said, it's so important. I mean, I can't stress enough. If you guys are in a position to do it, you need to. And we'll talk if you guys have questions. You can find ways, even if you have a lot of cats and cats in all your cages, you can still, you can at least put the portals in. You may not be able to open them the first day, but as you work towards getting fewer and fewer animals in, you can go ahead and put those portals in. So I would say start with that as you are reducing your number of animals you're bringing in.
Yes, absolutely. So we are going to go to questions, and if we go over, Olivia does have another obligation, so Olivia, feel free to jump off at any time. But I want to we'll just go to the last slide. And Lara, what questions do we have from the audience?
Well, thank you,
Lara,
to Dr. Sara. Oh, can you not hear me?
Okay, now I can. There's a lag.
You can hear me though? No?
Yes.
I can hear her.
Okay, perfect. Okay, so as you can imagine, a lot of questions came in. So we'll just dive right into them. Now, the first question came from Kaynella, who asked, do portals have to be round because they're currently using square portals?
Oh, that's a great question. They don't have to be round. In fact, the puppy portals are square or rectangular. So they don't have to be round. It's just the concept of having a pass-through and a door that can open and close. So whether that goes up and down or like the one I showed, yep, doesn't have to be round.
Great. And a follow-up question from Kaynella was asking, she's also dealing with some cats that only sit in their litter box and won't go to the other side where their bed's located. So do you have any insights or thoughts on this kind of behavior?
Yeah, Karen, do you want to answer that?
Yeah, I guess I can't ask for a question back, but a lot of times if you don't have a hiding place, like we sometimes just use empty boxes that we put in the cage. If they have nowhere to hide, a lot of times their litter box is the closest thing they have to a hiding space, so that's what they do. It usually means they're not yet comfortable with their surroundings. One of the other tricks we have, and it's, I don't know, we put a little touch of catnip in their bed area, and sometimes that'll attract them too. But if they're hiding in their litter box, try to put like a little empty box that they can go into for some safe space.
That's a great advice. And we're going to stick with the litter box questions here because Julie asked, is it better to use clay litter and wash and dump every day, or use scoopable litter and keep the same litter box until it gets nasty?
So, you know, what I recommend is disposable litter boxes in shelters. As much as I hate using the cardboard, but I just think it's, you know, it's less risk. It's less time the staff has to clean the plastic litter. It's less risk of having that plastic be scratched and then harbor pathogens. So I do think it is best to use the disposable litter boxes. And then the litter, I don't think it matters as long as the cat likes it. That's the real, you know, I think that clumping and clay is good in shelters because when you spot clean, you know, you don't have to change the litter every single time, but you can spot clean and scoop, if you will, during the day.
Great advice. I think I can relate to the cat picking out their cat litter. I can tell you my cat's just as picky. So follow-up question actually from Karen is asking, we are having trouble with volunteers washing litter boxes with dishes, cross-contaminating. So would you stress the importance of consistency in a sink for dishes, which is away from the sink where you clean the litter boxes?
Oh, for sure. Absolutely. Yeah, that is a huge no-no. Yeah.
And we are going to move on to Jose has a few questions. Jose is coming to us from Portugal. So they're bringing a very interesting perspective. So the first question is, are there any available guidelines or criteria to determine which shelter pets are or are not euthanized? Because in Portugal, it's prohibited to use euthanasia to control stray pets, but there has been some discussion around the need of it.
Interesting. Well, welcome, Jose. Thank you for joining us. So, I mean, the standards, there's no laws, right? But we have the guidelines for standards of care in animal shelter and shelters. And what we believe in animal welfare is we want to try to save every animal within reason. So the euthanasia pool should be medical beyond hope, perhaps pets who are infected with rabies, which is zoonotic, which people can get and die from. So those should be euthanasia candidates. And then large, dangerous dogs who cannot safely be rehabilitated. Beyond that, I think our industry, we do not believe in euthanasia for space or population control, but it is more medical and very severe behavior. Those are our guidelines, if you will. We also know that euthanasia, and I'm so glad to hear that in your country it's not used as population control, because euthanasia is not an effective population control tool. We've proven that for many, many decades.
And follow-up question from Jose was, do you think that microchipping cats would help improve the RTO? Because in Portugal, that's already in place.
That's amazing. The reason I don't, and I'll let Karen answer too, is because in shelters, I mean, when I looked at my very large shelter handling 37,000 animals a year, less than 10% of the dogs had microchips and very few of them were registered. So we're not doing well with dogs. So instead of having a whole nother campaign for cats, which I don't feel would be effective, what we need to do is sterilize them. So to stop this incredible proliferation and put them back where they're already cared for. That is the return to owner, if you will, program for cats. But no, I don't think that microchipping cats would be an effective tool. Karen, what do you think?
I agree for the most part. I mean, what we find is almost all of the cats that come into me are actually microchipped. Almost none of them are registered. None of them are registered, or they're registered and the people move. So what's interesting is, I would have to say probably all shelters, at least most shelters in the States, are, when they spay and neuter, they are microchipping. So when the animals get adopted, more people are getting microchipped cats. But if they don't know to register it, it doesn't help us return the cat. So
yeah, I love microchips. You know, I of course recommend it for owned animals, but for community cats, I think the best thing we could do is sterilize them and put them back where they're already cared for.
As even if they're friendly, guys, if they're healthy and friendly and they come into the shelter, obviously someone's caring for them.
Yes.
So put them right back where they came from is really important. That's the best way to get them home.
Well, our next few questions take us back to portals again, and we have Kim who's asking if there's any information about making cement units into double units.
Well, so we see that in the United States that the dog kennels a lot of times are cement, and they do have divider doors in them, so it absolutely can be done.
Okay, that's great to hear. Now we have Brenda, who is looking for a bit more information about how to make space for the portals, which would allow for 1 to 2 cats per enclosure when you're portalizing 2 to 3 cages that already have a cat in each of them.
So one of the things you could do is so in that picture I showed with 3 cages across, you could do 2 cages, and then the third column you could do up and down. So that's another option for you.
And next question comes from Karina, who asks, would it be recommended to start diversion RTF efforts before installing the portals?
Oh, absolutely. Start it today, right now, today. Don't let another community cat come into the shelter. Yes, because you're, like Karen said, the friendlies are somebody's cat, and guess what? They're probably going to Lara's house for breakfast, Olivia's house for lunch, and Karen's house for dinner. So they are somebody's cat. And so, yeah, they shouldn't be just going into the shelter to wait for a live outcome. That is absolutely crucial in every single community and shelter.
Well, we also have Heather here, who is looking for a little bit of advice because Heather rescued 2 smaller juvenile kittens that were too old to go to the shelter to be adopted, so they're now being told to TNR them. Heather thinks that they're too small to return to the apartment parking lot, where she built them a large enclosure in her carport until they can get surgery and vaccines, and she's socializing them. So Heather's asking if she cannot find them homes, can she incorporate them with her current community clan, or do you have any ideas around how she should proceed?
Yeah. Well, Heather, that's a really controversial question because nobody agrees on the age to return a community cat. So one of the things that we think about is, are the kittens feral and unsocialized? Then we feel better about putting them into, an existing place where somebody's caring for them. There are programs like in Jacksonville, they return them at 2 months because the 2 months of age, because the thought process is they were thriving and surviving there with people caring for them. So all we did was sterilize them. Other programs say 4 months, 6 months. So there's no right or wrong answer, but I would say do not take them to the shelter, right? She has to network and find them a home. But if they're feral, especially, and if they're friendly, I'm sure she can find them a home. But if they're feral, I wouldn't hesitate to put them back where she was already caring for them.
And we actually just had another question come in from Catherine, who's asking if you are ear tipping or otherwise marking all of your TNR cats, and do you worry that community cat owners will give negative backlash from changing their cats?
That's a great question. Yes, I didn't mention it, but is the left ear tip. That is the universal sign that the cat is sterilized. And what we found, this is all anecdotal, is that people are so happy that their cats are back that they don't, and when you have a mature community, everybody knows what an ear tip cat looks like. So no, they're just happy they got a free spay or neuter.
Well, that brings us to our very last question from Barbara, who is looking for some additional information on training. And Barbara's asking if you have any DVDs for purchase, for training volunteers, or any other resources for training, as well as information on starting a shelter.
I would definitely say the best practice playbook. It's all inclusive. It will talk about the public policy that needs to be in place. So it is the one-stop shop, and it is, I wrote it because I feel like it was needed in our industry. So I'd encourage you to start with the playbook, and there's tons of resources on there. All the national websites have so much great information, but start with the playbook.
Well, that concludes today's webinar. So thank you so much to you, Dr. Pizano, and to Karen and Olivia for sharing your experiences. This has been so fantastic, and it's been great to see everyone communicating with each other in the chat. If you have any other questions, please visit rescuedisinfectants.com. You will also receive a follow-up email with a link to the recording and additional resources. So on behalf of Virox Animal Health and our presenters today, thank you for joining us, and we'll see you next month for our next webinar.